LoginClinics. We are an online telemedicine and teletherapy or counseling practice, and we're based out of Wake Forest, of course, as you know, which is why we're here. So our mission is to provide high quality, cost-effective, and easily accessible direct healthcare and therapy to North Carolinians. So telemedicine is kind of a new concept. Some of you guys may have it with your own insurance companies, but you essentially use your mobile device, your smartphone to consult with a provider or a therapist. And so I think there's a little bit of a knowledge deficit about what telemedicine is. And some people are afraid to use it maybe, although there have been surveys and most people say, actually about 70% of people say that they would use it. And as well as physicians, nurse practitioners like myself, physician assistants, they say that they would use it as well. And I think just from my experience, when people do use it, they love it. They think it's amazing. They wonder, why did I sit in an urgent care for 3 hours when I could have just done this on my phone? And the same thing with counseling. We have a counselor, and she actually notices that she can connect a lot better with teens and tweens because they're in the comfort of their own home, they're in their room, they're on their smart device. It's just something that they're really comfortable with. I've been in healthcare for 20 years. I started out as a nursing assistant when I was 19. And now you know how old I am. And I got my RN and then immediately went and got my nurse practitioner degree. And I've just seen a ton of changes. We started with the pen and paper, you know, you can't read the writing, the order that the doctor wrote. And we went all the way to electronic health records with integration. You can see UNC, you have on your mobile phone, you have your patient portal, you have all of your labs, your CAT scan, you can show it, you can share it, you can email it, you can do all this stuff. So we did that, so that's been great. Medical providers have gotten more specialized, which actually makes the healthcare terrain really difficult to navigate and understand. So part of what LoginClinics does is we do healthcare mentoring. So if you have a cardiologist, neurologist, orthopedist, and you just don't really understand, they fly you in and out, you only have 10 minutes and you leave there more confused than when you first started. It's actually noted that you lose about 50% of what your healthcare provider tells you when you're in that visit. So I think there's a lot of confusion with that. And then insurance companies have changed a lot as well. It used to be, you probably remember, that you would pay the provider and then you would take your receipts and submit it to your insurance would pay it back to you, and then that switched, and then the provider started fielding that for you, but then came contracts and different fees and such. And then we went all the way to HMOs, trying to save money, contain costs. We'll pay for your primary care. Well, that didn't really work. So now we're doing high deductible healthcare plans, and you might have to pay a couple $100s a month, and then your deductible is $6,700, like a car every year you have to pay for before your insurance company will cover it. So that's part of why I started this business, was to really help people, educate people, provide an easy way for them to get medical care, to work alongside primary care providers to help people understand and feel. On average, it takes about 10 to 14 days for you, if you're sick, to get into a primary care provider, and that's just too long. You can't wait that long, so you're relegated to urgent care or the emergency room, which nobody wants to go to that I know of. And so just all of those things. And then one last example, I have patients that come into the standalone urgent care where I staff PRN, and they're hourly workers, and they come in because they've maybe had some sort of minor illness, they've had like a fever, some nausea, vomiting, whatever. They know they didn't need to go to the doctor. They're fine now, but they've missed 2 days of work, and they have to pay $120 just to provide that proof, that excuse, if you will, to their work. And so that was another thing that I just think is ridiculous, that we actually make somebody or ask someone to pay half of their weekly salary for a note that just says they were sick and they're no longer sick. So anyway, that's LoginClinics. That's our mission, and I neglected to introduce, I'm sorry, Lisa. She's our practice manager, Lisa DeGrow. She's amazing, in charge of all of this you see today. And then this is my staff photographer, Olena. And then this is Keith. He's my husband and business development manager. And then our two providers, other providers couldn't be here today, unfortunately. Sarah Harris, she's our licensed family and marriage therapist with over 14 years of experience. Her picture's on the table. And then Justin Bordeaux, he's a physician assistant, men's health champion. He unfortunately couldn't be here either, but his significant other is Jessica back there. Thank you so much for coming, and
We have to cut the ribbon.
Oh, we have to cut the ribbon.